find a way to promote individual ownership and choice, not have a government, federal insurance system that decides what kind of health care we can get and what we can't. And finally, we really want to look at how to fix the healthcare system and find ways to improve efficiencies in the system. Then we need to tackle the problems that we have already, which are the entitlement problems. Until we get a handle on the growing entitlements that we have today, it doesn't matter what we do on the market side, you're never going to solve that issue. And certainly far better than what the left is pushing, which is to say we're just going to fix it all in one swoop, and we're not going to address any of these issues. We're going to hide the way we pay for things, or we're just going to tax people the same old way. We really need to get down to the fundamental core of what's wrong in the healthcare system and truly putting individuals in charge of their healthcare decisions. Empowering them rather than Washington is probably the better approach at this point in healthcare reform.
Thanks. My background is I've been building healthcare companies for my career. The first one I built was a hospital company. We had 343 hospitals, 150 surgery centers, 700 home healthcare agencies. We took care of over 100,000 patients a day. And if you measure things and do the right things, you really can drive down healthcare costs and get better outcomes. The most recent company I started was a company that has 27 urgent care centers. When you walk in, it's got a menu board just like Starbucks. $89 to see a physician, $149 if you have one procedure, $229 if you have the works. We're 1/6 of the cost of an ER visit with insurance and 1/10 without insurance. And they're all freestanding. They're generally freestanding, 3,500 square foot, staffed by doctors. So that's my background. So after President Obama got elected, I got worried that what was going to happen in healthcare and started Conservatives for Patients' Rights. And the first thing we did is we put out 4 positive pillars of what ought to happen in healthcare. Because there's no reason healthcare costs what it costs. The reason healthcare costs what it costs is all because of the federal government, or primarily because of the government. So we put out 4 things. First, you ought to have the right to choose your doctor and choose a plan that you want. Not some plan with a whole bunch of mandates that the government mandates you buy. Second, we need more competition. Every provider ought to post their prices like we do. Everybody post their prices and their results. You can do it. Next, you ought to be able to sell insurance across state lines. So we have more and more competition rather than a government plan trying to come in and compete. Third, you ought to own your own healthcare plan. We ought to allow you as an individual the same tax breaks as we give employers, so you care about what your healthcare plan costs, not what the employer pays. Fourth, you have to be responsible for eating right, not exercising properly, and not smoking. So we've got to reward people for taking care of themselves. So that's what we put out. And the first thing we did was I retained a guy by the name of Gene Randall, who was a freelance anchor from CNN, and we put together a documentary just to show the consequences of, because I own hospitals in London and own hospitals in Sweden and compete against government systems over there, to show the consequences if we go down this path of government health care. So we put together, and you have, it's about a 20.5-minute documentary. We're going to show 2 minutes of how it impacts people. There's a lot of policy debate, but people don't talk about how it's going to impact your kids, your spouse, and your parents.
So in the UK today, you're going to die quicker than any other country in Europe, and we have the worst access to new treatments. So the two are combined, obviously related. So this is the problem. I feel that the National Health Service has let me down, because I feel that if I'd had a smear test when I'd asked one originally, I wouldn't have gone through everything that I've been through now. And I feel that them raising the age limit has pretty much signed my death warrant.
The very expensive new drugs which are coming out for cancer and other things, it's hard to get hold of them without a big struggle.
I know I've lost time, and that doesn't make it easy, especially when I'm getting such good results, and it is holding back the disease. But it's got a lot of disease now to hold back, whereas had I been able to have it last May, it didn't have that much invasion in the liver and bones and other areas of the body.
It's heartbreaking, especially if people can't afford to buy the drug. And I use tricks to try and get them, but often you just can't, and that's really heartbreaking.
No, what we have in Canada is access to a government state-mandated wait list, and the wait lists are long. the patients are languishing and suffering on wait lists. Our own Supreme Court of Canada has stated that patients are actually dying as they wait for care in Canada.
It's kind of like, well, live with the pain, and whenever we can get you in, we get you in.
The wait list here, and thinking of waiting another 2 years for surgery, and what I was going through, my business was going downhill. It just wasn't worth the wait. And to get your health, people always say if you got your health, you got everything. I believe that.
I pay taxes. Everybody pays taxes. We pay our insurance, and we get nothing out of it. When there's a need, we can't even access it.
So if you watch this video, you see all these things, and that's, we all talk about how much things cost, the policy and all this, but this is actually what's going to happen to us. So if you just go down, Kate Spall's mother had cancer, operable cancer, because of the wait time in England. She had to wait months to get her surgery, so she passed away. It was operable. She died. Katie Brickle, 19-year-old girl, in college, says, "Gosh, 19 years old. It's time to get my first Pap smear test." In America, you get it the earlier of 18 or 2 years after you're sexually active. She goes to the doctor. Says, "No, you don't get it until you're 20 in the UK by law." So she goes back at 20 to 2 different doctors. They say, "Gosh, you're just a little late. We just changed the law to 25. The government did. You cannot get it until you're 25. And even if I did it, the lab wouldn't process it because of your age." She's at 23. She's now has cervical cancer, and she will die within the next year. Angela French still doesn't have the cancer drug she deserves. Her husband was a diplomat. Has spent a lot of time in Canada and the United States, and she's been waiting to get the drug for over a year. Still doesn't get it. Deb, the lady that has the cancer that looked pretty sick, she was 51 years old. She married her third husband, and she looked younger than he did. He's 11 years younger. And but she has cancer. She has breast cancer. Couldn't get the drug she wanted. She figured out she needed Avastin. The doctor said, "Yeah, you do need Avastin, but you don't get it in the UK because it costs too much." Because as Greg talked about, the quality adjusted life here was too expensive. So she says, "I don't have any money. I'm going to do bake sales. I'm going to sell my house. I want that drug." He says, "You're not going to get it because you can't even use your own money." So she goes and finally gets an article 7 months later in the New York Times. The next day she gets Avastin. The government changed the rules for her, and she got Avastin. But as she says, now it's got way more cancer. Dr. Sikora will tell you, he's an oncologist, a big-time oncologist. If you're 70 years old, we don't even tell you the treatment options because we know the government will pay for it. Brian Day, he's a doctor orthopedic surgeon in Vancouver, Canada. It's illegal for him to do procedures outside of the government system, but he does it. And because people are waiting on wait lists and just dying. And then Charlie Watch, it was going to be 2 years to get a hip replacement. 2 years to get a hip replacement. And so he came to the United States and got it done. And Don Neufeld had heart arrhythmia, 200 beats a minute, was in the ER almost once a month, almost passing out, almost dying. And he had 2 businesses. He was losing his businesses. He came to the United States for care. And then the last young man, mother talked, he had a soccer injury, and he waited so long that now it's a permanent injury. So that's government health care. So the reason why we all ought to be very active in this debate is these elections have consequences. The Obama health care plan has consequences, and that's what's going to happen to us and our families. Greg talked a little bit about the stimulus bill and the Federal Coordinating Council, and that's passed. They have the IT. They're going to be able to follow this. If you look, there's in one of the handouts, it talks about importing rationing to America. They're there. With the Coordinating Council where they can decide comparative effectiveness, they can do it. In March 1998, that same type of organization started in the UK. It's called NICE, the National Institute for Clinical Effectiveness. Started out doing the exact same thing our council is going to do. We're just going to do research. We're not doing anything else, just doing research. It was 11 years later, does research, tells the doctors exactly how they're going to practice, which will be easy in the U.S. because they'll have the IT, and then they put a value on your life. And then, so if you need drugs, life-saving drugs, you will not get them.